2. Hello, everyone. We are so excited to have you join us today. One of my favorite things about the first of the year is knowing that Posture Month is coming in May, and what a huge opportunity this is to help promote the chiropractic profession and really to help promote your clinic within your community. And I always love, and we have the opportunity to have Dr. Stephen Weiniger come and be a presenter on our webinar series. This man is crazy busy, traveling all over the country, speaking all of the time. And I say this every single time. If you have heard Dr. Weiniger on a webinar, but you have never seen him live and in person, you are really doing yourself a disservice. Hands down, out of any class you will attend at a state association event, not only is it educational, beneficial for your practice, but hands down it's the most fun class you will attend. For those of you who aren't familiar with Dr. Weiniger, he wrote the book on postural motor control exercise, Stand Taller, Live Longer, an anti-aging strategy, and is trained to help patients find relief and rehab accurate motion with strong posture protocols. He is a faculty member of the University of Western States, created the free PostureZone assessment app. Super cool. You really need to try it if you haven't. The Certified Posture Exercise Professional Program, and spearheads the PostureMonth.org global public health education on the health impact of poor posture. So I'm going to be quiet and turn it over to Dr. Weiniger, who is a ton of fun. Please make sure that if you miss anything, I would just sit back, relax, absorb what he has to say, go back, listen to the recording, and take additional notes. Dr. Weiniger, it's all yours.
Christy, thank you very, very much for your kind words. I truly appreciate it. And if you've been busy, great. If you haven't been busy, Posture Month is an opportunity to really start to stir interest in your community, in your practice, with the idea that posture is important and you can and should be the posture specialist. We've been doing PostureMonth.org for the past 5 years as PostureMonth.org. Before that, we did it less formally, helping doctors, especially CPAPs, to promote themselves with posture. And this is one thing that we do for the chiropractic profession, because posture is such a strong branding concept that people get is connected to chiropractic. My license plate says posture, and if I'm parked in a supermarket or a mall or someplace, a restaurant, and someone sees my plate, they say, "Oh, you're a chiropractor." You want someone to be looking at you from a positive point of view in a way that makes sense. And Christy, thank you for telling folks about our webinars. We'll be traveling around the country. We've got a bunch more seminars that are in contract right now. But if you would like us to speak at your association conference, let us know. The campaign strategy for 2018 is communication, especially with other healthcare providers, MDs and others, because they can be a great source of referrals by communicating with your patients and the public in your area, but with actionable posture information. And that's key. It needs to be actionable, and it needs to be perceived, which needs to be really, truly be for their good, not just a thinly veiled marketing program, because people, especially today, people see through the sales so much more than they did once upon a time. And if you're using silly strings to look at posture, you need to be up in your game. The world is different than it used to be once upon a time. The 2018 campaign message is ace your posture. Be aware, take control, optimize your posture environment. And the toolkit and the share images this year all reinforce those themes. Taking posture pictures and is one way to be aware. Other ways, things like Fitbit and the Apple Watch, other wearables, apps to remind you about your posture. We get probably one a week, different authors of different, maybe sometimes more than that, from different companies asking us to endorse them, to help people tell about them, or if they're doing development, sometimes we've been part of it. As often as not, more often than not, we don't deal with them because there's a lot of people out there marketing and hawking posture. if you want to be perceived as a posture specialist, you want to be doing it in a way that is the way a physician, a clinician takes care of posture, helping people. And this is why you need to be, if you are going to be communicating and branding yourself with the PostureMonth public health campaign, you need to be doing it within your practice, integrating what you're doing and how you communicate and how your team communicates posture to patients and to the potential patients that you're educating your patients to create in their small corner of your community. You want to be connecting with people and engaging with people. And this is the beginning point, not the end point, the beginning point to position yourself to medical professionals and other healthcare providers as being the posture specialist. Because your patients very often are the key to connect you with that person's medical doctor by the words that they candidly tell that medical physician. That's how you're being judged, like it or not. And if your patient isn't telling your medical physician about what you're doing, you're missing a huge potential for referral from that medical physician. The patient can refer a couple of people. When you get an MD that is seeing other back pain patients or that occasionally has a patient ask about back pain, then you are leveraging tremendously that patient's referral benefit. This is especially important now. When I say now, I mean in the past 2 weeks, there was a big report that came out in Lancet. Lancet is a tier 1 journal that came out with a global call to action on low back pain. And they basically talked about how low back pain is the leading cause of disability and its burden is growing rapidly. And this was not just an article. It wasn't 2 articles. It was a series of articles with a recommendation for what comes next. And this was embargoed from release until March 23rd. So there was a lot of press release that was about it, that was in the air about it, and it was all over the media. Good Morning America, which is one of the widest watched shows on old school TV, came out with a health alert. New research on lower back pain. This is a screenshot of the words that they had on ABC. The question is, are millions of sufferers getting ineffective treatment? The top line said, new report warns of widespread ineffectiveness of lower back pain treatments. Lower back pain affects 540 million people worldwide. It's the #1 cause of disability. The cost is unknown, and the reason why they're saying it's unknown is because different estimates range from billions to mega billions, not mega, but to literally $200 billion is a not unreasonable estimate to how much back pain costs. And at the end of it, they said that, okay, what can you do for back pain? This was their advice to consumers and to patients. Putting superficial heat on it, which is going to work for a little bit of time, doing spinal manipulation, massage, acupuncture, and if that doesn't fail, then try NSAIDs, things like Advil and Tylenol. And this comes on the heels of the new guidelines from the American College of Physicians that came out that recommended even more strongly against NSAIDs, certainly against opioids, and also what was in favor of spinal manipulation, as well as motor control exercise, not just working out, but motor control exercise. More on that in just a minute. In terms of NSAIDs, a study that came out last year was a meta-study that looked at 35 other studies on NSAIDs. And the conclusion was that NSAIDs have only a small effect on pain relief and improvement of function. Moreover, those small effects may not be perceived as important for most of the patients with spinal pain. And by the way, those who were taking NSAIDs had 2.5 times more gastrointestinal issues than people that took a placebo. And their conclusion included the fact that it's not clinically important for people that have had back pain for over 7 days. So having NSAIDs in your body is not going to fix the pain. This is what more and more medical physicians are being told. And the people that are seeing these issues, predominantly doc in a box, nurse practitioners, internists, PCPs. These are all people that are in the communication sphere of the American College of Physicians who talked about the new guidelines for low back pain, including spinal manipulation. This is a huge opportunity for doctors of chiropractic that do spinal manipulation. A recent study talked about how everybody knows how posture causes pain. 89% of PCPs consider biomechanical risk factors like posture to be the single most important trigger for sudden onset low back pain, according to a European Spine Journal study. The CDC has officially declared the U.S. a prescription drug abuse epidemic. More Americans die every day from prescription opioid abuse than from heroin. Okay, back pain is not the end-all to posture, and posture is not the end-all to chiropractic. However, back pain is the key to begin a dialogue with somebody, and posture is the key to communicate with them why they're having a problem. And this is a point that many doctors tend to gloss over, and they're surprised when patients don't follow through because they came to the doctor with pain, they wanted the pain taken care of, and the doctor embarked on a re-education campaign, which is not an evil thing, but if you want to buy a hamburger and someone tries to sell you the supersized burger with lettuce and tomato and vitamins on top, you might just say, I just want the hamburger. And someone's going to tell me that you shouldn't eat hamburgers. Agreed. Well, sometimes you're eating good beef, I might argue the point. But the point is, posture is something that everybody gets, especially because there's new research talking about its broader impact on health. It's a perfect way to connect with people past pain. The idea that sitting is the new smoking is this is from one of our PowerPoint slideshows. A 47-study meta-study talked about how if you spend 12 hours a day sitting, you've got a 91% increased risk of type 2 diabetes, increased overall mortality risk of up 24%, heart disease mortality is up 18%, cancer mortality up 17%, and the risk of developing cancer is up 13%. In the same issue of Annals of Internal Medicine, the editors, those are the people that choose what goes in, said in the article, Too Much Sitting and Chronic Disease, Steps to Move the Science Forward. They said that we need more research. The potential for innovative approaches to reduce health risk of too much sitting, particularly for primary prevention, is considerable. There's going to continue to be more research coming out about posture in the next decade because of the tech society that we live in and the increasing amount of research that's showing that keeping your body flexed for a large part of your life has health consequences. And this is why, especially for this year, with the new Lancet study and the American College of Physicians guidelines, the 2018 campaign message of Ace Your Posture, not come to see me and I can help fix your posture, but be aware of your posture, take control of your posture, and adapt your intelligent posture environment makes a ton of sense. And the campaign is set up for the 4 weeks of the month of May. Week 1 focusing on awareness, week 2 control, week 3 on your posture environment, and week 4 tying it all together with ACE life habits. And we're going to go a bit into what each one of these concepts entails, but if you have an interest in working with us to promote posture for your practice in your community, to the people that you're talking to and that you're reaching, and leveraging the message that's going out on our part to the larger community as well as to other media, you want to go to PostureMonth.org and register for the Posture Month, for the May's Posture Month campaign. We'll be giving you guys guys and gals, a free toolkit as well as a free listing on the PostureMonth.org website. This is one of the share images from the campaign, and these will be being released during the month of May. It's time for your 2018 posture analysis. People with strong posture are healthier, look trimmer, and more confident. You should have a posture picture every year. It should be part of your physical exam. It's one of the things that defines your health. But if you're not looking at it, you don't know what's going on with it. That's the goal. You want to make people aware of how's their posture and opening the door to what they can do about it. And hold on, I'm not the thing that you want them to do is not coming to you and signing some huge contract for 5 years worth of care for $10,000 and any nonsense like that. Believe it or not, the best way to help people is to be authentically helping them to help themselves. If you can help them be more aware of their posture, that can make them more conscious of how they move. And when people become more conscious of how they move, and you adjust them for a problem, they become more conscious of the benefits of what you're doing from a chiropractic adjustment. Chiropractic can do more than most people realize. The thing is, from our point of view, you want them to realize it for themselves, to feel it and to see it. Picture's worth 1,000 words. It's way better to show somebody what's causing the pain in a picture of their body than to try to explain it, to make them aware of what their body truly looks like and aware of the health benefit, of the health issues that happen with posture, which is not quite the same thing as consciousness. Awareness means that you know about it something, but it's not that you're personally conscious of it. Getting them to consciousness, that's the trick. We don't see the world as it is. We see the world as we are. One of my favorite authors and gurus, Stephen Covey, having read 7 Habits of Highly Effective People, highly recommend it. It's old school, but it's real. It's the way people work. When you show somebody a picture of their body, not just trying to pathologize the head over the torso, but to show them how they're balancing the body and how they're training the muscles to be with that, with the torso going back and the head going forward, it makes sense to them. And connecting that, and these are some of the this is some of the signage and share images that are going out for PostureMonth. It's time to strengthen your posture for pain-free movement, sports performance, and for the taking pictures, an idea to make people aware of: take your picture yourself. Here's how. Use an app or see a professional. It's about building awareness and communicating biomechanics in a way that makes sense to everybody. But this is a really important point. You don't want to pathologize posture. You don't want to make it a disease. You want to make it a measurement. And you, as a clinician, can help people to interpret the measurement. It's like if somebody has a blood pressure that is 2 points high, it doesn't mean that, oh my God, you need to have heart surgery tomorrow. It means you need to start monitoring it and say, what can I do to help myself? Maybe I need to start exercising a bit. Maybe I need to start having one less hamburger or not put cheese on my hamburger. Or maybe I need to go on to a low sugar diet because maybe sugar is really more the problem than fats. That's a different issue. The key is actionability. When you empower people to do something about something, and they do something, and it makes a difference or doesn't, they care about it more. And if it's not making a difference, and then the next question becomes, what can I do about it? This isn't working. If it does make a difference, but not as much as they'd hoped, then the next question becomes, what can I do about it? And that's where you want to be in terms of helping people authentically, not pathologizing the issue. And this becomes huge, especially when you're talking to other healthcare providers or when your patients are talking to other healthcare providers who may be somewhat more savvy and somewhat more aware of some research going on than your patient may be. The difference between being self-serving as opposed to fostering and promoting self-help is credibility and authenticity on the part of the person viewing your actions. And one point that I would like to tap, because this is one of the issues that have been going on in the postural world, categorizing postural measurements as abnormal posture is way poorly substantiated at best. Current literature says posture has minimal impact on pain and dysfunction, and I'm not saying that I completely agree with this, but this is what medical people that you want referring to are going to see when they go look at any of the big journals out there. My point is, as a chiropractor and a clinician, as a human being and a father, fear-based marketing hurts practices. In the short run, you can build people up, you get people to sign contracts and come in, but long-term, what they tell other people ends up not being a strong engine to grow long-term, and you have to keep on pumping that harder and putting more money into marketing and advertising. It also hurts the chiropractic profession. You don't want to have a marketing program that's based on fear. You want one that's based on education, understanding, and desire, especially if your desire is to work with people on a wellness basis to help them stay well. Well, what kind of studies are out there, and where are they? Are they in some of the smaller or less reputable pay-for-say journals that would put an article in if you pay them to do so? Or are they in Tier 1 journals like, for example, European Spine Journal, 2016, the association between cervical spine curvature and neck pain. They found that in group with neck pain, there was no association between clinical characteristics of the pain, which include the duration of the pain, the frequency of the pain, intensity, whether it radiated or not, whether or not there was sensory and or motor disturbances, if there was a disability in the person's case, and their economic utilization of healthcare services. For those people that had that kind of neck pain, there was no relationship between those clinical characteristics and the global cervical curvature or the segmental angles. And yes, a lot of chiropractors will disagree with me. This is not my words. This is European Spine Journal. Take it up with them. But your medical physician, if he is looking for research, he's going to be looking for things like this. The presence of such structural abnormalities in the patient with neck pain must be considered coincidental, i.e. not necessarily indicative of the cause of pain, are their precise words. A different study this is not a medical journal, this is from Chiropractic and Manual Therapy. Does chiropractic lordosis change after spinal manipulation for non-specific neck pain? A prospective cohort study. And that's different from a retrospective study where people that you worked on that got better. But they found no difference in cervical lordosis and sagittal alignment between patients with mild, non-specific neck pain and healthy volunteers. Furthermore, there was no specific change in cervical lordosis in patients after 4 weeks of spinal manipulation. That said, I've seen changes in spinal manipulation affecting curves, and I know a lot of friends that are doctors have seen it as well, but these are some of the articles that are out there. Different article, again, from European Spine Journal. Does the sagittal alignment of the cervical spine have an impact on disc degeneration? And this is one that I think is interesting because we had a 10-year follow-up of people that didn't have symptoms. There was no significant correlation between the sagittal alignment of the cervical spine and the clinical symptoms. The sagittal alignment of the cervical spine had some impact on the progression of degeneration with aging. So if there was a loss of curve, there was more breakdown that happened. However, it didn't correlate with the occurrence of clinical symptoms. Now, I'm not saying that I totally agree with all these studies, but I'm saying that this is what you'll find when you start looking at the hard science studies for what's going on with this. And especially if you're doing any kind of legal work with PI cases, or you have the possibility of having malpractice, which is everybody, you want to be aware that if you ever go to court, these are the kinds of things that somebody that's on the other side can pull up, because this is what's out there. On the other hand, when you look at studies talking about the deviation of the overall structure of the body, as opposed to just looking at high shoulder or high hip, the orientation of gross body segments with respect to the gravity line was superior to local spinal pelvic features in terms of clinical importance. In other words, if the whole body is deviating over where you're standing, there's more mechanical stress on your body. If there is if the head is stacked more effectively over the torso and pelvis and where you're standing, the body's working better. And so that's the point of awareness. Not trying to pathologize something, not trying to make a disease, but make somebody aware of when you think you're standing straight, when you think you're sitting and texting with whatever posture you think you're doing, what does your body truly look like? This is why taking a picture is a way to begin benchmarking that clinically, educating them, which is pretty easy because when someone looks at the picture, if there's deviations of where the head versus torso is, and they think that they're standing straight, the question is, why am I standing like that? And the answer is, why did you know you were standing like that? That's the problem. You think this is straight. Retrain somebody to empowering them how to do something and how to move differently to strengthen their posture. And this is one reason why for May is Posture Month. I'd like you to join us, bodyzone.com, and thousands of other health and fitness professionals, and the people that are following them online with a free listing on the PostureMonth.org website. Yes, free. The reason why we do this, why Stephen Weiniger does this, is because I know posture is important, and I know chiropractic is important, and I know that unless we become something larger in the world, other people will take what we've built, like spinal manipulation, as a clinical therapy for low back pain and neck pain. And chiropractic is more than that, but that's right now the most utilization for chiropractic. Other people will take that and use that and be able to help more people with what we've done going forward, because science and evidence is going to rule what happens in the next decades. One of the things in the toolkit is how to take a free posture picture, but you don't have to use an app. You do need to use a camera. In fact, I would far rather people just use any camera than do something that pathologizes the problem. That said, I think that the smartest way to take a picture is to observe the posture using what we call a functional definition of how the body is balancing, aligning, and moving. Bam. And when the body masses are 4 posture zones: head, torso, pelvis, and lower extremity. And in brief, if you're looking at a body, someone standing up straight, if the body is flexing with the torso is going forward or the head's going backwards, yes, it affects the curves, but it also affects where those masses are with respect to the gravity line of where someone's standing. It also means that if the body is zigzagging back and forth, there's a loss of height. And what we do is we're basically blocking those body masses of head, torso, and pelvis. And if you look at those blocks of head, torso, and pelvis over where the person's standing, if the pelvis is being stationary, torso is going back and head's going forward, the more there's a variance in the angle of those posture zones of where you're standing, the more you're basically measuring how much of a zigzag that whole body is having. So it's not just the curves that we're talking about, it's the effects of the curve on the larger system. And when you look at the larger system, you're also empowering people on how to do something to strengthen it. So if you look at a body, looking at the picture to the left, where the head's going 3 degrees to the left, torso is going to the left, and the pelvis is going to the right, you can see where the body is flexed. The body is within 1 degree. That's about as good as anybody's going to get. And the goal is not to make it perfect. The goal is to benchmark where it is, teach somebody how to strengthen the balance, the alignment, and motion against an objective vertical, against objective cues in external reality, and retrain them to be more accurate to reality. We call that process training them by attentional focus, by PostureZone, by balance, alignment, and motion, to reduce the deviation from gravity line alignment. It also means the body is functioning more efficiently because it takes more energy to balance when the body is zigzagging back and forth. So when you're taking a posture picture, you want to start with the instruction to not stand flumped, not stand regular, because no matter what you say, they're going to try to stand taller. You want to start with stand tall. I want you to show me your best tall, strong posture. And if they do something really locked and rigid, tell them to relax. And a funny thing happens. They don't know where that is. They'll zigzag back and forth, and then they'll decide, okay, now I'm standing straight. At that point, you can't laugh. Funny thing happens, they start to become like not even sure where standing straight is. And the point is the head should center over the feet. So if you're looking at a PostureZone picture, if it's less than a degree to the left or right, that's fine. The left and right side of the torso should be deviating about the same from center line. The pelvis should also be deviating about the same. So instead of just looking at high shoulder, high hip, you're looking at how those body masses are deviating, which is a way more sensitive observation of the mechanics of what the body is doing to balance. And if you haven't checked it out yet, check out the PostureZone app. The basic version is free, but it's designed for the posture specialist to use with patients and the public. So you want to have people download the app, and it's really easy to use. All you have to do is bracket the person between the top and the bottom line to rotate it, to capture the image, rotate it so that the line turns green when they're standing tall, and then clicking the camera button to take a picture. You want to select the side view or front back view, and then you have indicators that you can then bracket around each posture zone for head, torso, and pelvis, lower extremity. If it's an AP view, there's a left and right side, torso, and pelvis. And so when you've done that, you press the PostureZone button, and you get a picture of the symmetry from the front view or the alignment from the side view of head, torso, and pelvis over where the person is standing, measuring that picture from angular deviation, not pathologizing it, but just benchmarking what they are truly looking like when they think they're standing straight. So then next year you come back and John, it's time for annual posture picture, and over time you can track changes in symmetry with treatment, with effort, and or if they're not doing anything. Last year you had a 1.5 degree deviation. This year you've got 2 degrees. And look, you're losing height a little bit, not a lot, but the more your body zigzags, the more you're scrunching down, and the more your muscles and ligaments tighten, as well as joints breaking down. If you want the pro version, it's a one-time purchase, $29.95. There's no per use fee, no per month fee, no nonsense like that. And you can generate PDF reports, import, export the pictures and the PDF reports, do comparisons on up to 4 pictures, have a table of the observations. Plus, you can add other angular deviations for sports assessments, workplace. If you want to do squats, things like that, all different hip hinge testing. You can add other kinds of testing very, very quickly and reliably. The goal is having a framework to teach people how to be posture aware. Because next, we want to teach them how to take control of their posture. Your posture is shaped by what you would do with your body. You want to be able to teach people how to move well, using that PostureZone framework as a way to begin educating them. But how to lift intelligently, how to sleep intelligently, sit intelligently, moving intelligently, to use that PostureZone attentional focus to strengthen how they move with the body in daily activity. And these are some of the shared concepts from the PostureMonth.org May's PostureMonth campaign. But it's designed to fit hand in glove with the PostureZone framework and app that's used to work with the strong posture exercises. The strong posture exercise protocols focus on balance, alignment, motion, or BAM. And yeah, we've been knocked off and copied by different people out there, and that's fine. The point is, if you read the ideas from Stand Tall, Live Longer, it'll give you and gives your patients an idea of the posture principle concepts and the alignment and balance and motor control exercises. That strong posture exercise teaches people how to strengthen, to build more mechanical effectiveness, to build greater stability and avoid injury. The goal is not fixing a posture. The goal is not perfecting a posture. The goal isn't normalizing the posture. It's making it go towards normal. It's functionally strengthening it. And the thing that we talk about, if you can brand yourself as a posture specialist with biomechanics, patients get it from a rehab and wellness point of view. The public gets it, especially if someone that's connected with you on Twitter or Facebook sees something from your feed. And instead of saying, come to me, we're doing free x-rays today and free package deals or whatever, we're telling people, stand tall, be aware of your posture. Take your picture, here's how. If you want us to give you a hand, come on by. The goal is creating a public awareness in your patient base and the people that you know to help you connect with other healthcare providers as well. And in terms of strengthening people, yes, you need to be getting people to strengthen the core. The problem is many times they think they're working the core and they're not. Part of strengthening motion is strengthening the inner core control, which means to do that well, you must be retraining how those 4 posture zones are balancing, aligning, and moving, or BAM. The connection between torso, pelvis, posture zone 2 and 3, that's the core. The inner core muscles, diaphragm, TRA, pelvic floor, multifidus, is what you want to get to firing when you teach people how to control their body. So teaching them exercises in a clinical setting can work really well and does work well, but you may also want to teach them how to do other things outside the clinical setting. that correlate with what you're doing. For example, one of the PostureMonth images is using walking sticks. Exoscribe is one of our sponsors for PostureMonth, and they teach people how to walk using sticks to close the kinetic chain of the torso and upper extremity and walk with stronger posture. This is another one of the share images. Every movement starts with posture. Every movement ends with posture. Having an office that you're communicating these ideas of biomechanics and sharing them online as well, not with a come to me tomorrow, I'm the doctor, I need to make money. I mean, I want to see patients. I mean, I want to help you. But here's how you can help yourself. Be aware of your posture and then do something to control it. And one of the things that we have is also free images for the beginning BAM exercises. And some of the concepts from Stand Tall, Live Longer, those posture principles. First one's motion, second one's balance, third one's patterns. Your body moves in a chain of motion that follows the path of least resistance. Creating an awareness of posture helps you to then translate those motions into things you do in everything that you do in life. For example, this is one of the self-help things from Stand Taller, going up and down a flight of stairs with strong posture. If you see somebody going up a flight of stairs where the body is leaning forward, even if they don't have a forward head posture, if the torso is aligned over the pelvis, if the head's aligned over the torso, vertically, only looking at those two dimensions, you're not going to get a picture of how the body's truly moving. If you're looking at where the head, torso, and pelvis is over the feet, picture on the left, you can see that it's not just about the head and the torso, it's about how the whole body. One way that you can create awareness is to have somebody wearing a tie or a pendant when they're going upstairs. The tie or pendant is against the chest. That means the torso is vertical, and the effort of engaging the extensor chain to do so, if you're looking straight ahead, tends to pull the head over the torso as well. The posture is a whole body phenomenon, and that's why it's so key to strengthen the whole body to strengthen posture. Especially because of that study that we talked about, those guidelines from the American College of Physicians, their new clinical guidelines, talks about non-invasive treatments for acute, subacute, and chronic back pain. This is a clinical practice guideline from the American College of Physicians. That means it's not just a study, it's not just a meta-study, it is a compilation of everything that's out there that they come out with once every decade or so, and they say that the last one they came out with is before this one was 2007. They say that now we know better, and now people should be doing things to take care of their body. Motor control exercise include things like yoga, Tai Chi, which are great things, but they are hard to do in a clinical setting. The strong posture exercises are motor control exercises. And things that clinicians should do are spinal manipulation. And that's the key to connect with medical people. If they don't know about these things, you can be the voice telling them, especially if you can speak with intelligence about it. Salgado did a great study. Training posture to move towards symmetry with control has a clinically important effect for chronic low back pain, especially when you exercise, because you exercise with adaptive motion. Your body gets better and better at moving with that adaptive motion. PostureMonth.org talks about doing motor control exercise, and that's some of the things that we share. But the motor control exercises purpose is to correct sensory motor errors. The problem is if you think you're standing tall and you're not, when you go to exercise, your form has become adaptive to that adaptive motion. The strong posture BAM protocols focus on balance and then alignment and then motion to cue your attention to be more accurate to reality. And when the person gets better, and they do, they can feel and you can see the difference. It's an ongoing spiral between balance, alignment, and motion to retrain how the body is balancing. And we use one-leg balance exercises that are progressive to their functional ability, how the body is aligning using an objective wall to correlate first torso-pelvis, then head-torso-pelvis, and then tying extremities into it in a very focused, systematic way. And then moving strong with the ball using, again, deep core control. And that's the beauty of teaching things systematically. So somebody is off and they're working on a ball, the asymmetry of motion on the ball becomes your cue that they're not moving with symmetry. If they think they're doing something clean and symmetric and with control, but the ball isn't moving cleanly and with symmetry, their perception is wrong. So you can use the ball as a test as well as an exercise of their functional weakness. And it becomes a test that they're doing every time they do the exercise, so when they're not moving well, they can feel it. And that's the idea of using things like the handouts from the rehab box to help your team systematize how you're cueing and doing those exercises. You're looking to observe the symmetry or lack of symmetry of the mechanical alignment and the motion coupling. For the jerky motions are telling you that there's arcs that are not being controlled of what they're doing in order to balance and align as they dynamically move. Like all these strong posture rehab protocols and the handouts and the basics of it that we teach with CPEP is training strong posture control using must versus try. The try is to focus attention on accurate motion in someone's pain-free functional range by PostureZone. The kicker is you can only focus on one thing at a time. And sequencing that in a way to focus on one thing at a time in a systematic way is a great way to have a busy practice, helping people tremendously in a really efficient way. But even for the public, the handouts of the strong posture exercises on the sharing, which is that will be coming out successively during the month of May, will be strengthening how you balance your body, and then strengthening how you align each posture zone with an exercise to do exactly that. To give them a little bit of information, teach them how to do it, and they get a little bit better. They can feel the difference. And then if they're still having pain, or you become more aware of how they're not moving well and they're seeking help, the person that they're more likely to see is someone that is helping to teach them about it. These are, again, the ideas from the basic public idea. Stand Tall is a public book that a lot of docs use for training staff and patients. The Rehab Box is one of the CPEP tools in the Certified Posture Exercise Professional. So the ACE framework of ACE Your Posture begins with awareness, week 1. Week 2 is strengthening control using the beginning strong posture exercises. And week 3 is strengthening your posture environment. What is a posture environment? It's how you're living with your body and what you do, how you sit, stand, sleep, the kind of chair you're sitting on, or if you're not standing, if using as I am right now, I'm at a stand-up desk. If you're standing up, are you using orthotics in your shoes? What kind of bed are you sleeping on? What kind of pillow are you using? To things like what kind of racket you're using, or if you're using a walking stick rather than just going for a walk. Looking at your posture environment and optimize it for your well-being by looking at those posture zones and getting people dialed into their awareness of their own body, and this is key, their awareness of the importance of head, torso, and pelvis, so that they can then look at other people's bodies, the people in their environment, people they care about. I can't tell you how cool it is when you say to a patient, John, you want me to take your posture picture? You can go home and show your wife what you look like. And then he goes home. He doesn't show his wife how he's doing. He says, honey, stand up straight. He takes a picture. When they look at it, he says, oh, my God, you look all bent. I never looked at you. I never stopped to pay attention. I was never aware. Once you're aware of it, the question becomes, what can I do about it? Guess who they ask that question? They don't call me. They call you. The goal is getting you to talk to them about posture. Actually, the truth is, we do get quite a few people asking me about that. I'm not practicing these days. I'm busy enough. I was in Vegas at the ACA Rehab Council last weekend, Philly weekend before that, Western States weekend before that in Portland. This weekend, I'm excited. I'm going to be home. And I'm going out hiking this weekend, hopefully, maybe kayaking. The goal is creating an awareness and a conscious mindfulness of how people move. Mindfulness has become big in a lot of things. Walking is a great exercise. There's a difference between moving mindlessly and mindfully. And it can make a big difference even in how people feel and their pain level. If you spend 18 hours a day sitting with your body folded, your body's going to fold and age more quickly. That's why teaching people how to connect with the posture at work, to move better, to sit stronger, having a monitor at the right height can reduce mechanical stress. Even not even sitting on a chair, sitting on a ball. You want to engage them in other options to consider. If they can, I'm a big fan of sit-to-stand desks. We use the upright ergo. If you would like to get one for your practice, let us know. We can get a great discount for you as a chiropractor. Additionally, if you want to connect with us, we can get it where if you sell someone to a patient, your patient gets a discount, and you get a discount. Anyway, Upright Ergo is a PostureMonth.org sponsor, and we appreciate their help in putting it out there in their environments as well, that posture is important. Creating an awareness of how to take a posture picture when people are sitting is a beginning within the workplace wellness community to optimize someone's posture environment by aligning posture zones. Notice the direction. It's not pathologizing. It's not saying, oh, you've got bad forward head posture. You've got computer back or tech neck, and so I need to treat you. The problem with that is even if you help half the people, the other half that you don't help are not saying positive things. And over time, more people that are dissatisfied by far talk than people that are satisfied. So one of the keys to building a long-term successful practice is satisfying most of the people most of the time. And not having a hard pressure sales, but making them aware of things like the Cervipedic, a big fan of it. They also sponsor us, and they have an inflatable cervical curve pump to put the neck into a neutral posture, and it helps cervical curves as well. Again, cervical curves are something that everyone in the profession knows about. There's some disagreements in the world. It's not wrong to talk about it, but I would not hang my hat on a measurement and make a measurement into a pathology. Posture observations and measurements should be just that. The pathology should be the symptom and the mechanics of what's going on, and you helping them to strengthen their body addresses that is a model that, when you talk to other physicians, makes sense, because that's how the healthcare world works. And week 4, tying it together to come back to anything that interests the patient or that's relevant to the patient from your perspective, to strengthen their life for strong posture life habits. Until next year, when you open the door to reach out to them again to say, come in for their annual posture picture. So help us ace posture in your community and join us. May is Posture Month. We will give you a free listing on the PostureMonth.org website if, there's an if. Yes, there's an if. You got to take posture pictures. You can use any technology. No, you can't draw with a crayon. You need to take a photograph. But you can use any technology. And number 1 recommendation, use the PostureZone app. Number 2, just use any camera. Take a picture. We'll be giving you the toolkit with tools for weeks 1, 2, 3, and 4 to be able to assess and communicate posture. And if you want to have any information, there's a lot more data on the PostureMonth.org website. Again, free directory listings for people that will take posture pictures, and you can see some of the people that will do it. Basically, you want people to be finding you, especially as we get media about Posture Month. We're doing a 31 Days of Stronger Posture concept, as well as we have giveaways going on for consumers. So if you tell your patients to share it on their social media, they can win stuff. They can win things like TheraBand balls, or actually we even have an upright ergo desk. There's an exercise poles, cervical pillows, cervical supports. We have a number of different different gifts for this year's Posture Month that we'll be doing drawings on during the month. These are all ways to get attention, getting media to pick up the message, and getting you to help us put it out there. Ace your posture. Be aware. Take control. Optimize your environment. If you want to be taking posture pictures, we suggest getting a PostureZone grid. You don't need a grid, but it does make it look a heck of a lot more professional when they go home. And next time, it's a standardized background to take the picture against. We have more variety of different grids than anybody else on the planet. We have wall grids, door grids that are small. They fit on the back of a standard 3.0 door, as well as portable grids for screenings. The wall grids are not this cheap batter material that That's what the knockoffs are using. It's a hard plastic, and the grids are made to be used as an exercise station as well. The blue of the grids doesn't rub off. It doesn't, and it's a hard thick plastic. It's not a flimsy batter. We also have them in metric as well if you are outside the USA, and it's one of the again, PostureZone and the PostureZone grids are one of the sponsors for PostureMonth.org. The posture model that we talk about with CPAP and everything that we do. CPAP is Certified Posture Exercise Professional. It is to start with acute care, the pain relief. Get them moving pain-free. Then rehab care, functional improvement and restoration. Get them moving well. Then wellness care, optimizing how you feel, perform, and age. And right now you're probably saying, yeah, we do acute rehab and wellness, and that's cool. The point is, you should also be having something that you're doing to help the world, because that's what you do. That's what a professional does. That's what a good person does. A public health message about strong posture habits for everyone, intelligent strategies for posture awareness, control, and environment is what we talk about with the posture practice model of ACE. Because ACE is not just a message for Posture Month, it is a roadmap to a posture practice. And we can talk about this a whole bunch. If you have an interest in joining PostureMonth.org, that's free. If you'd like to be able to start doing some strong posture exercises, I recommend you get the Rehab Protocol box. It's regularly $249 on the Posture Practice website. If you're ordering it, there's a webinar special. We'll drop you an email about it, that it will be discounted. Additionally, if you order it by this Friday, we will give you a free TheraBand ball. It's regularly $35 value. These are the Pro Series, not the basic ones, anti-burst. Like everything we do, it's quality, and it includes the basic handouts for the strong posture exercise protocols, as well as a video of the basic beginning of the BAM alignment track, as well as patient handouts that you can hand out, as well as staff training manual, and a copy of Stand Tall, Live Longer. If you'd like it also, we'll give you the prescription pad for Stand Tall, Live Longer. That is a tool that you can use to recommend what they should read in the book while they're on therapy to answer the different common questions, both about exercises as well as understanding posture. And this is one of the many tools in the CPAP program. We're giving it, if you order this by Friday from PostureZone or Posture Practice, we'll be happy to give you both the ball and the prescription pad script. The Posture Principles book, Stand Tall, Live Longer, talks about those 5 posture principles. If you want posters or handouts, you can buy them on PostureZone as well as other information about Posture Month. If you want to start to play with us and really own the niche of posture in your community, go to PosturePractice.com. Check out CPAP, Certified Posture Exercise Professional. It includes live seminars, and we don't test people out unless they've demonstrated proficiency. I travel all over. I was at the ACA Rehab Council last weekend. We'll be doing seminars in a bunch of places for the rest of the year. And you need to, there's a difference. It's like adjusting. Watching a video is good, but you need someone to give you live training. The back end of CPAP, the members area, has video libraries with different peel backs and progressions for the handouts, as well as a 15-hour online course. But you also, to be part of CPAP, ultimately you need to test out. And there's other tools for CPAP as well. If you're in CPAP, there's a CPAP webinar that you'll be hearing about for the Posture Month program for CPAPs as well. Also, if you CPAP, there's in Atlanta CPAP PEPT training. That's for people that are training other CPAPs. We are setting up national locations for others to be training in CPAP as well. These are some of the 2018 dates. And again, it's hands-on. It's real. It's not just read this book. If you want to connect with me on Facebook or Twitter or any other things, drop me an email. There's my information. And Christy, if you're here right now, if there's any questions, now's a great time for it. Additionally, if you want to buy any of the things we talked about, PostureZone.com is tools for posture practice. PosturePractice.com is information about CPAP, as well as the things that we do, as well as our seminar dates. If you want to drop me an email, send an email to cpep@bodyzone.com. And
thank you, Dr. Weiniger. We have one question. Somebody wanted to know if they could get a copy of the slides from this presentation today.
Drop me an email, but we generally can't give out slides for presentations like that. We do have, depending upon what you want, we may have something that fits the bill pretty perfectly. Drop me an email.
Wonderful. So it seems to be the only question that we have. If you have a question, please go ahead and submit it now. I want to take a few minutes to remind y'all next week we're going to be going over how to hire a great team and help them consistently perform with you with hiring expert Jeff Henderson. 2 weeks later, or a week later, 2 weeks from today, the Cash Practice is at Fact or Fiction, presented by Dr. Mario Fuccineri. So if you haven't registered for those webinars yet, please make sure you go online and take care of that now. Let's see. I don't see any additional questions. If you have any additional questions, please make sure that you reach out to Dr. Weiniger and let him know if you have any, follow up with those questions. I am notoriously one of those people that I will not think of a question until 30 minutes after a webinar or the next morning or at 2 o'clock in the morning. So if you have them, write them down, send an email to Dr. Weiniger, and he will email you back the answer to that question. I really want to encourage you to really promote PostureMonth in your practices. This is such a great opportunity to really engage with your community. We have another question. It said, is it too late to make it by May?
No, the reason why we're doing it right now is because now is the perfect time to do it. One of the things about some of the work that we do from a postural point of view is that it's strongly progressive, which means that you don't have to know everything. You need to know one step more than the person that you're teaching. And this is the way that we also have doctors training their staff and do staff training programs, because if you ever try to teach staff how to do rehab exercise, if they don't have a strong background in it, you'll find that their consistency sometimes is weak. Using the must versus try cueing and the handouts becomes invaluable, because if you're turning somebody loose on one exercise for a week, you teach them how to do it for 3 people, using the handouts, using the staff training manual from the rehab box, then they do it for the same week. You've got right now 3 weeks to get through the beginning of May. If you're doing something clinical, you only want to be teaching them one exercise at a time. So you've got plenty of time. You're not going to be able to teach everything, but the point is, you don't want to. If you want to work out with weights, ultimately bench pressing 200 pounds, and you can bench press 40 pounds, you don't go in and say, okay, next week I'm going to do 200 pounds. There's no such thing as unrealistic goals. There are unrealistic time frames. What we've done with the Strong Posture Protocols is exactly that. We've protocoled what it takes to move people to what their body can do in a way that each handout, each exercise becomes very bite-sized, so you can communicate it with an exercise session within the practice. And when you come back, you test them. And if they're doing it tightly, you progress them. If they're not doing the must versus try, then very often it means that there's a mechanical problem that you need to fix from a clinical point of view. It might be an adjustment, it might be a soft tissue injury, but it's dramatic, the changes that you see when you restore motion. So now's the perfect time. In terms of taking posture pictures, if you order it now, you probably will have it by next week. You got the weekend to put it up, you got plenty of time. Getting the 2 things you want, the one thing you want, if you want to get one thing, would be, to me, getting a PostureZone grid. The second thing would be getting a rehab box. If you want to start really training, both that and a ton of other stuff is included in the CPEP program. So check it out. And if you're doing that within the month and you want to get CPEP by the end of the month, tell them that you're on the ChiroHealth webinar, and that Dr. W said that we'll apply whatever you spend this month fully towards CPEP. After that, we usually do 70 cents on the dollar. Did that answer the question?
It does. Thank you so much, Dr. Weiniger. And thank you for everyone who was on the webinar live today. Again, if you have any questions, please email Dr. Weiniger after today's presentation at drw@bodyzone.com. Dr. Weiniger, I sure hope I get to see you soon at an event. I feel like I haven't seen you in months.
I will probably be. I think I'm going to be at Boca in FCA in June. Will you be there?
I will be
If
there,
not,
so I'll finally get to see you then.
you will finally get to see me then. I look for. Actually, you know what? I'll see. I'm coming back. You're talking about traveling. I'm coming back from Boca on Sunday, and I'm leaving on Monday for France, and I'm speaking at the college in France on that week. So I look forward to seeing you.
Well, I look forward to seeing you too. Everyone, I hope you have an amazing rest of your day and a fabulous week, and I look forward to seeing y'all next week, same time, same place. Bye-bye, everyone.
Pleasure. Bye-bye.